The FDA now revoking emergency use authorization for certain COVID antibody treatments that have already been given to millions of Americans. The agency says the drugs from Regeneron and Eli Lilly don't work against the Omicron variant. StarMed, Atrium, and Novant Health had already pulled them off their shelves at the end of last year. And given the short supply nationwide, appointments are extremely limited. WCNC Charlotte's Chloe Leshner is at StarMed's monoclonal antibody treatment center in Southeast Charlotte with more on how to get the treatment here locally.
Now that only certain monoclonal antibody treatments can be used, there's a bit of a supply and demand issue. A lot of people want the treatment, but StarMed Healthcare only has about a 1-week supply. As COVID mutates and new variants emerge, treatments have to change too. Omicron, which makes up the majority of new COVID cases, can resist certain monoclonal antibodies that have been used for months, and the ones that work are in short supply.
We're hopeful at that point to make sure we get another supply in from the state.
Monoclonal antibodies are given to someone within days of testing positive for COVID. They're meant to keep them from developing a severe case that could require hospitalization. Local providers are now prioritizing who can get them.
At our peak, we had a capacity to do over 200 a day here in Charlotte, and right now, due to obviously supply issues, we're having to be we're really having to filter out and make sure we're giving it to the most high-risk patients.
People who are 65 or older, who have underlying health conditions, or who are immunocompromised are more likely to qualify for the treatment.
You know, there's multiple factors. It's not always you can't always use a cookie-cutter approach.
According to the FDA, if the drugs are effective against any future variants, they could reauthorize their use. StarMed Healthcare also has the antiviral pill treatment. The CEO, Mike Estramonte, says he thinks that will be the game changer. In Charlotte, Chloe Leshner, WCNC Charlotte.